This is ACEP's Capital Minute, a look at what's happening in Washington, D.C. right now, affecting emergency physicians and your patients. I'm Laura Wooster. Two bills regarding opioids specific to emergency department that ACEP was heavily involved in developing are now before Congress. Introduced to the Senate and House last week, the Alternatives to Opioids in the Emergency Department Act, or ALTO, would provide $30 million over 3 years to establish a demonstration program that tests the ALTO approach as a way to limit the use of opioids in emergency departments. Additionally, another bill that ACEP worked closely on was introduced last week in the House. The Preventing Overdoses While in Emergency Rooms Act will provide $50 million over 5 years in grants to establish policies and procedures for administering medication-assisted treatment in the emergency department to overdose patients, in conjunction with referral to community providers. Stay tuned for more news, as hearings on the opioid epidemic will occur in multiple committees in Congress in the next couple of weeks, and ACEP plans to stay closely involved. According to a CDC analysis published in Vital Signs last week, near real-time data from emergency departments showed that emergency visits due to suspected opioid overdoses increased 29.7% in the past year. Deborah Howery, director of the CDC's National Center for Injury Prevention and Control and an emergency physician herself, cited success with several state-level emergency department interventions in a related op-ed she co-authored in Annals of Emergency Medicine, emphasizing that emergency physicians have a unique opportunity to engage in prevention of a future overdose, particularly for patients who may not have had other contact with the healthcare system. To read the full CDC Vital Signs report, go to the URL on your screen. This week, ACEP Board of Directors member Dr. John Mark Hirshon was on Capitol Hill participating in a Ways and Means Health Subcommittee roundtable on their red tape initiative to reduce provider administrative burdens. Hirshon talked about the impact administrative burdens have on the daily workflow of emergency physicians and the complications and interference they can cause for patient care.
We all know how hard it is to be able to practice emergency medicine, and the regulatory burden continues to increase and increase. Whether it's trying to get permission to be able to do advanced imaging or to be able to access records related to patients with opioid or other substance abuse problems, we know how difficult it is to practice in emergency medicine.
The pressure is on major health insurance companies to protect the prudent layperson standard. ACEP has been working closely with Senators Ben Cardin of Maryland and Claire McCaskill of Missouri to raise awareness of Anthem's controversial emergency care policy and ensure that the prudent layperson standard is being properly enforced. Last Monday, the senators sent a joint letter to HHS Secretary Alex Azar and U.S. Department of Labor Secretary Alexander Acosta, calling on them to review Anthem's policy of retroactively denying coverage for their policyholders' emergency visits. To read the letter, go to the link at the bottom of the screen. Registration is now open for ACEP's Leadership and Advocacy Conference in Washington, D.C., which will be held on May 20th to May 23rd. We recently confirmed that HHS Assistant Secretary for Preparedness and Response, Dr. Robert Kadlec, will speak that Monday at the LAC Public Policy Town Hall. Additionally, there will be other speakers, seminars, and of course, the Hill Day, where you will meet with your congressional representatives on emergency medicine-related issues. Both Louisiana Senator Bill Cassidy, MD, and Representative Kirsten Sinema of Arizona will address LAC attendees Tuesday morning. For more information, go to the link at the bottom of the screen. That's ACEP's Capital Minute for the second week of March 2018. I'm Laura Wooster. Thanks for joining me.